Hi everyone, welcome to researchmd.com. We got another great presentation today. We've been doing a series on melatonin since there was a lot of reports coming out. There is increased use of melatonin all across the United States. So today we're going to look at a drug, a very good drug, a very important, I would say, drug interaction between melatonin and warfarin, okay? So, or warfarin also called as a Coumadin. So again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I'm also director of research, and I teach medical students and medical resident. I'm also assistant professor of medicine. So let's get to our subject. So melatonin, as we know, melatonin is actually produced by pineal gland. There is this luminous information coming from the retina. They go to the suprachiasmatic nucleus in the hypothalamus, and then it says signal go to the pineal gland. It starts secreting melatonin. Okay, so how does it work on the coagulation cascade? If you look at the coagulation, this is what the blood clot formation pathway, we need to know that, right? There's two types. There's intrinsic pathway and extrinsic pathway. Intrinsic pathway, you got 12 to 12A, 11 to 11A, 9 to 9A, and then 10 to 10A. Then you got extrinsic 7 coming into play, where 10 to 10A pathway, and then prothrombin to thrombin, and finally fibrinogen to fibrin, and form the blood clot. And this is the cascade. This is the basic mechanism. So we need to look at each one. First, we look at melatonin. How does it affect the coagulation cascade? It acts on this factor. It acts on the conversion. On factor 8. Okay, and it also acts on fibrinogen. Those are the two places melatonin acts. So what's going to happen? This is going to make the patient bleed because there is less blood clot formation. Now, warfarin, if you look at it, the effect is on factor 2, which is prothrombin, and then factor 7, and then factor 9, and then factor 10. So those are the four areas. It also decreases protein C and protein S. Okay. So next thing is we did a research on the internet and find out, like PubMed, see, like, is there any research studies kind of looked at it? The only thing we were able to find this study was a case series. Objective was the study to investigate the potential drug interaction between melatonin and warfarin or Coumadin. So what did they find? Design of the study is a case series, and the population is only 10 patients who are receiving melatonin and warfarin concurrently. Results, there is an increased trends in the INR and prothrombin time when we use melatonin and warfarin together. So what are the weaknesses of the study? Again, it's only a case series, only very few number of patients in there, not like a very good scientific study, but we already looked at the pathophysiology. How does it work? We already know melatonin can make the patient bleed. So there is definitely, based on the study, melatonin can interfere with the warfarin, and they can increase the prothrombin time and INR and may contribute to bleeding. So it's a good idea to check PT INR frequently. And again, please consult your doctor. We are not giving any advice for your medical diagnosis. You should consult your doctor for medical diagnosis. Again, thank you so much for watching. We'll be back with another presentation, and greatly appreciate you could support our channel by subscribing. Thank you very much. Bye.